So Andy, you and I have talked strategy over the years, and yeah, which I love. So when you're
Yeah,
talking about in the role that you're in, thinking up use cases for AI in
yeah,
healthcare. When you introduce a product of any kind in any market, you
yeah,
gotta you have to assess the competitive field, right?
sure,
Um,
sure.
you got to ask questions: is there a product or service that currently solves a problem of your
Yeah,
target market? And if so,
yeah,
how can we replace or displace, that service, through
yeah,
quality, price, whatever?
yeah,
But when we talk about innovative products that disrupt the system or change the game,
hmm,
that usually comes from outside the market, like Uber and
yeah,
or TikTok
yeah,
or whatever.
yeah,
And that's
yeah,
because it saves money, it improves quality of
yeah,
life, offers new
yeah,
experiences, reduces friction, whatever. Let's think like short and long term with healthcare
yeah,
as it relates to AI products. What are some near term opportunities that
yeah,
you see for AI to
yeah,
either replace current products or services in the healthcare system that will improve, our lives? And what do you see as downstream opportunities
yeah,
for AI to possibly disrupt
yeah,
healthcare?
yeah. I think in the short term, and you're right. I think with the advent of ChatGPT and that sort of going viral quickly and what's possible and all those kind of things, the challenge in healthcare is that just because something is technically possible doesn't mean anyone's going to adopt it or use it because like you can something can be very technically possible in the general world and you can go buy it and subscribe $20 a month and get your chat gpt or whatever, but in healthcare, again, all the same things we talked about. Is this valid? What's it doing? How does this work? And so, these models we've talked about, these predictive models that a doctor then makes a decision, like relies on the AI and then makes a decision about, those are going to come over time. They're technically possible today. We can do these things. We can predict, HRD status from an H&E image. We can predict, whether a patient's going to be responsive to a certain kind of treatment just based on images, right? We can do that. It's technically possible today, but it's not really going to be adopted in clinical everyday practice for 5, 10 years for a lot of reasons. What's really exciting today, and as patients you probably have seen this today, or maybe you go to your own doctors, like is the ability for AI to reduce the administrative burden on healthcare providers.
Mm,
Right? So
absolutely.
so you can see where large language models, hey, I'd like to record this and use an AI agent, great. So instead of your doctor staring at their laptop, firing away on the EMR and putting all the stuff into Epic, they're just having a conversation with you. Hey, Rome, how you doing? How's the family? Hey, how's your shoulder? Okay, what happened? You working out again? You heard a pop? Okay, what did that sound like? Okay, you go through all that stuff, and then hey, I'm going to prescribe you some medicine. Where's your pharmacy again? Okay, great. Okay, why don't you come back in 2 weeks? We'll take another look at it. All that gets captured by the AI. All that goes right into the clinical note. Your prescription got sent to your pharmacy the minute he said it. All of that stuff, and now that doctor, instead of spending 40 minutes later trying to remember that conversation you had, can go, yeah, that's exactly right, and click go, and now they're on their way. So I think reducing healthcare burnout is a huge issue, and so I think AI, that's going to be the immediate impact. That administrative burden, prior auths, something I know you love, near and dear to your heart, right? You're trying to eliminate prior authorizations. How do you do better at that? Well, AI can start to do that, right? You can start to get into these worlds where maybe there's gold card messages. You already know certain things about the EMR. AI can extract that information, package it up, send that immediately to insurance provider, even while the patient's still in office. Get that authorization done when that patient's ready to get the treatment, right? So that there's not this weeks of administrative burden on an oncology staff, for example, to try to get a prior. So there's a lot of AI capabilities that I'm not saying going to replace anything, but maybe replace a lot of pain, which I think is how you get things going, and that's what we're seeing right now. I think in healthcare, a lot of these things like DAX by Nuance, Microsoft, which is this AI transcription tool. But I think too for patients, I think we're going to start to see things for patients. So at Tempest, we launched an app called Olivia, which is really all about patients having access to their own records and having AI help them with it. And you can also use that same app to do the same thing in your doctor's visit. Say, hey, doc, I'm also going to use an AI agent to help me with this. And so, you have a lot of people, doctor comes at you with a lot of big jargon, a lot of words, and like, oh my gosh, I don't know what he's talking about. All gets transcribed by the AI, and you can go back into that AI and ask AI questions. Hey, what did he mean by a BRCA mutation? I don't know what that is. AI will describe it to you. Hey, I don't really understand what he means by chemotherapy. What does that mean? And all of the AI can then help you understand that doctor's visit after your doctor's visit. So I think that's really the short term thing is just reducing these terrible administrative burdens and really helping patients and doctors like come back to each other.